Welcome to Living Vividly, the podcast where health, wellness, and curiosity collide. I'm Jackie, the founder of Vivid Health and Wellness, your guide on this journey to living your happiest and healthiest life. I'll be joined by some amazing co-hosts who bring their expertise and energy to every conversation. First up, we've got Daphne, our unconventional yet totally brilliant registered dietitian who's never afraid to shake up your approach to food. Then there's Dr. Mary Beth Moss, a physical therapist with a special passion for helping dancers move better and live better, no matter what stage of life they're in. And of course, we can't forget our trusty producer, Dustin, who helps keep everything running smoothly behind the scenes. We'll be having informative and engaging conversations with health and wellness pros, plus everyday people who've got incredible stories of their own health journeys. Whether you're looking to fuel your body better, move with ease, or just learn how to thrive in this crazy world, we're here to help you do it, all while living vividly. So let's dive in. Welcome back to another episode of Living Vividly. Today we're joined by Dr. Alayna Clark. She's a perinatal and pediatric chiropractor specializing in pregnancy, postpartum, and infant care. Her work emphasizes gentle, holistic chiropractor care, supporting the body's natural ability to heal, particularly during pivotal life transitions like pregnancy, birth, and early childhood. Thank you so much for joining us.
Yeah, thank you, ladies, for having me on. I'm excited.
What got you into this line of work?
Well, when I was in chiropractic school, they just teach you, how to be a chiropractor, be safe about it, just the very basics of things. And there's usually different, just like how in, like MD school or whatever, anything like that, they have different programs that, like your residency and things like that. We would have different organizations that would come in and just offer up, hey, we're doing this training for specialization, blah, 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 whatever. There had been some that I was like really curious about. One in particular, there was acupuncture. Realized you have to actually be an acupuncturist in the state of Louisiana, but you can actually do it in Texas. So I was like, okay, maybe can't do that. And then there was a functional medicine one that I actually really considered just because of, how great it is, honestly. Yeah. And then didn't do that one, although I had thought about it for quite some time. And then there was another organization called the International Chiropractic Pediatric Association, ICPA for short. And I took their Webster certification, which is pretty important in the chiropractic world for pregnancy. And so it's just a special evaluation and assessment of the pelvis and the sacrum. And so I'll never forget, she passed away a few years ago, Dr. Jeannie Ohm. So she taught the Webster class. That's like the first class to start off the series.
So you're saying Webster?
Webster
is the certification?
Yeah. Okay. Yeah. So everybody, at least in the chiropractic perinatal world, if they want to even work with women, you don't have to have it, but it definitely gives a really good overall picture of what to look for, at least start with. And so that class just... I was so mesmerized. I was like, wow, this is so cool. And she mentioned a movie, and I'm glad we're bringing this up too, The Business of Being Born. And that changed, if you're not in your head. Yeah. So it changed so much for me. And even just that training in itself, that whole entire series really shaped and opened my eyes to this holistic world and a lot of other things. I'm just leave it at that. And, I just found myself really addicted to getting more and more and more involved in the training. So that's kind of where it started.
Well, so I have a question about that, because in my mind, chiropractic just in general is more holistic. Like that would be a holistic branch of medicine. So whenever you're talking about, it sounds like you're saying it's even more holistic than what just chiropractor. So what is the difference? What do you mean by that?
So the school that I went to, they were very sports based. So I was already against the grain with doing the things that I was interested in. So if I can go back, I'd probably not go to that particular school for knowing if I would have ended up in that particular. So anyways, they taught us how to be observant with because you're actually a physician. So under the state of Louisiana, in most states, you're a chiropractic physician. So we're able to we actually learned how to do pap smears. So and then I think it's in the state of Oregon, we can at some point deliver, I don't know if I'm saying this correctly, but because of midwifery, you can seek out that training and then be part of that, and that would be included in it. So we learned how to do phlebotomy if we wanted to, because all of the states all have different scopes of practice.
Right.
And so they had to make us be well-rounded. We do blood pressures and Some chiropractic offices can do physical exam, like physicals and DOT and all that other kind of stuff. So we had to be able to evaluate. I mean, we diagnose people with musculoskeletal conditions,
Okay.
But we had to be able to risk if they needed to risk out of something and catch something. So like we've done ear exams and like a full just head to toe assessment.
Mm-hmm.
I didn't realize
that. Yeah. Oh yeah. No, if you've ever looked at, it's really funny because they'll joke about like, oh, chiropractors aren't real doctors. And you're like, please go look at all of the
training,
the trainings and in-depth stuff. I mean, we are not medical doctors because we don't learn medicine, but we do have a pharmacology and
a
class
physical
that we've
doctor.
taken and that kind of stuff. So it's very in-depth. I mean, we're learning radiology right out the gate. Some chiropractors do go on to become what's called like a DAC, but it's basically a radiologist as a chiropractor. So there's so many, and I did not realize this until like I got into the how versatile chiropractic really is and how much you can specialize in it.
So
it's
not just
one of the
necks.
coolest things. Yeah.
That's really what before I'm knowing you, that's what I thought.
Yeah, because everyone always is just like, oh, back pain and workman's comp and PI and all this other kind of stuff. And then I really and maybe it's just because I'm in the pediatric perinatal world, is like, I feel like just only within the last few years it's really taken off. And not a lot of people know about it here in town. So I feel like it's just starting to kind of like really take off. And there's only a few of us in town who are trained. Right. And like who have done the extra training. Now there's chiropractors all over who are like, they see them, they do well because they've always done it, whatever. That's not a big deal. But yeah, there's only really like a handful of us and everyone else is doing the typical,
Well, so the perinatal world is it's very specific though. I mean, there's a very specific population that you're working with because obviously not everyone is in that perinatal,
No, yeah.
And then you only got 50% of the population that it can even be considered, and then of that population it's very specific to a certain
so usually
target.
Whenever most chiropractors have like a family practice, they see you'll see them say, okay, there's a perinatal, I see pregnant women and families essentially with kids, and they're heavy on the kid aspect of things, which is great. Like a lot of those chiropractors are working with kids on the spectrum, and at one point I did want to do that, but it just is like a beast in itself. And I am very much a go down the rabbit hole kind of person. And we'll get into this too, but like I like to learn as much as I can about that thing and do the best that I can and offer the best of that kind of stuff. And I found myself going down too many rabbit holes with too many specialties.
Be 100% at everything.
It's so hard. Like I would just balance and juggle all these different plates, and it's just really difficult. And so I'd rather just say, hey, look, I have a really good friend of mine who's across town and she's phenomenal at it. Just go see her. Like she's great. I don't mind handing you off or like recommending that kind of thing. And I just do the same thing for like, I do that with birth. So I'm that way about pregnancy and infant care. So it's just kind of how I ended up with that. But
is there a pivotal moment that shaped the way like your approach to care?
So I have a running history with the medical system. So I've grown up in it because I've always had health issues. So I have a lot of like kidney bladder history. And so right out the gate, like when I was an infant, I had surgery on my bladder and just all these things. And I was very prone to UTIs. And so I was on a low dose antibiotic for the first 10 years of my life every single day. So you can just about imagine how wonderful my gut is doing. I love the medical system. I'm grateful that they're here when we need them. But I always found myself, and even my mom has, like Epstein-Barr and all these other chronic, things that most women have nowadays, unfortunately. And I just, going through life and seeing, okay, this is how far we can get you. Okay, thank you for being honest, or you're really not being honest. Like, you know what I mean? Like, this is as far as we can go. Best you can. This is the best that you can. Thank you for keeping me alive. But like, how are we going to get out of this? Like, what's the next step for this? And I just from that and the resilience I've had to muster up, I guess, that has just built me into like, okay, there's more to this story. I'm very like investigative. Like I just actually found out something about myself recently that was also contributing. So like I just, I guess I just don't settle for like, this is what this is. And so I think that's really carried into what I've seen in the maternal health world. I ended up with half of the certifications I've got because I'm always like, women deserve better. We deserve better. I see the outcomes that are happening in our town or just like overall in the world. And Louisiana doesn't exactly have the best statistics when it comes to maternal mental health or, birth interventions in general. So I'm just kind of like, okay, how can we do better? How can we show up? Like we always talk about the village, like if you're in the world, in the birth space, and it's like, okay, well, how do we show up as the village? How do we do better? Which I'm sure you do the same thing with all of your patients and clients. So it's like, okay, how can I be better for them?
Right.
And over the years, I'm like, okay, I didn't love that. Let's do how can I do this better for them? So that's kind of how that ended up in that. So it's like little moments, I think, over time that just kind of shaped it.
So if I were a pregnant mom, maybe like just finding out that I'm pregnant, 6 weeks in or something, maybe a little earlier than that. At what point would be best for me to start working with you? And what would be the goal be during pregnancy? Like during that, what feels like forever in pregnancy.
The first half of it is pretty, it feels like the longest. I'm going to give you a very chiropractic answer and say, of course, sooner rather than later. But
so early on, I mean, even before you have any physiological changes or, physical changes.
But I yes, as a chiropractor, I'm going to say, of course, sooner rather than later, but also because I see women at so many different points and I'm like, we would have just caught this before. We wouldn't have had to work looking for so hard. So, okay, so let me back up for a second with this. The things that women typically like when the ranges that they come in that brings them in. So in the beginning, they're probably a little bit more on the preventative side, or maybe we've done some like preconception work or something like that. Or maybe they were patients of mine that already had back pain or something, but they knew they were going to start trying very soon. And I'm like, perfect. Let's get you on like a wellness schedule, whatever that looks like. And then we'll just kind of see if anything arises, but we'll stay pretty proactive in that. And then as things go along, then we'll do some birth prep kind of stuff because I do all of that with them. And then usually the next like batch of moms are usually around the time where they're really starting to grow and have big growth spurts in their belly and their posture, or maybe they're adapting to life physically, right? So there's different things in their environment that are stressing their body. And so it's showing in like signs of back pain or just round ligament pain or pelvic pressure and pubic pain and just all these little things that can pop up. And so I find that batch to kind of happen around like 18 to 25 weeks. Okay. Just because that's when they have the biggest growth spurt. And I just had a mom actually come in the other day. I think she was 15 and I was like, yep, you're about to have that happen, but she's going through a move right now. So she's moving houses. So I'm like, it's just happening to you sooner rather than later. And then sometimes I'll have moms come in maybe like 30 to 34 weeks pregnant. Maybe a breech situation where babies head up and they want them head down or that kind of thing, or back pain, one-sided sciatic type stuff. Those I have to be a little bit more like, we got to roll through some stuff and they work a lot harder, because they're at the end and we have to get things going. So mostly I'm addressing their physical pain and the discomfort. And then based off of their birth goals or postpartum goals, we then move from that pain management to prepping for that and kind of setting them up for what that looks like.
I'm thinking back at my pregnancy, wishing that I had worked with you the whole time because I had all of those things.
Yep.
Because I'm so short, my back is already swayed and I had sciatic pain. Oh my God, I was miserable for 9 months almost.
Well, and it's so common, right, for providers or just like society to tell us like, oh, it's so common. It's okay. Like you're going to be uncomfortable and pregnant. And look, yes, you will be uncomfortable. You're growing a whole human. Your entire body is changing and adapting. That does not mean you have to suffer. Like under no, there's no point in
you can't
doing
sleep
that
through the night.
Yeah. If every time you step, there's something going on, or you feel like you're going to feel like a bowling ball's in your pelvis, but just like different little things, you don't have to go through that. There's so many other tools and people out there to help you.
So is there anything aside from pain that would, that you feel like should propel someone into your office aside from like back pain? What other like pelvic symptoms might they see? I mean, your pelvis obviously is changing tremendously during that time. So what other symptoms would get somebody into your office?
Yeah. So sometimes I'll even have moms with no pelvic pain or anything at all.
Mm-hmm.
They're coming in for maybe like upper back pain, headaches, that kind of thing. Sometimes they're just coming in because like, hey, look, I'm trying to have a VBAC and I want to prepare my body as much as I can.
Mm-hmm. And explain what a VBAC is.
Yeah. So a VBAC is a vaginal birth after a cesarean. Okay. So that would be something I would be interested in because I had a C-section for my daughter.
Mm-hmm.
Typically that has to be done in the hospital just because midwives, they can't legally attend that at home at the birth center. So anyways, you would have that be with a provider. And sometimes with a C-section, I mean, I like to look at their history, what are their past birth experiences like? That can really tell me a lot. And sometimes women will continue to carry that pain with them throughout. They're like, hey, like I had this when I was pregnant. I thought it would go away maybe after I had my baby. Never really, happened, went away or anything like that. I'm pregnant again. I want to get ahead of it. Now I'm carrying a toddler
right
on my hip and now it adds an egg, or maybe I didn't have it in the first, pregnancy. Now I do. And I think the conversation too, that I know not a lot of people, hardly anyone is really talking about, is how these pains and imbalances in our body can actually affect our birth outcomes.
In what way?
So whenever you have, for example, say if you have a mom with a very exaggerated like anterior pelvic tilt. And so that's whenever, like big sway low back, might have some like tightness in the low back, that kind of thing. Getting that baby past the inlet and engaged, right? You're like, oh, my baby's just so high up, right? Having a hard time getting engaged. But man, your pushing phase was really easy. Well, your outlet's open. So it might be, you know what I mean? Or those babies who are like kind of stuck in the pelvis, a little crooked, sideways, that kind of thing. Mom's maybe a little one-sided, shifted in that way. Kind of, it's been a little harder to navigate. Maybe pushing took a long time. So any kind of like asymmetry, it's kind of like walking through or getting through a door. And if you're having to navigate the door, it's a lot more difficult than just like opening and walking through it. Right. Okay. It's the same thing with birth. So between chiropractic care, exercise and movement, I love pelvic floor PT. So getting all the internal work done too and being proactive is going to set moms up for so much more easeful births in that capacity. And then of course, evaluating and assessing pelvic floor tension too. Because if you're going, everything's going well, but you're hitting a wall, it's going to make, again, pushing a lot. It's be harder to surrender to that. Does that answer your question?
Yeah. So some of the pre-work, I mean, in the beginning, you're getting them set up so that they stay aligned, is what it sounds like to me. Aligned. And then once you get into like the preparation for actual birth, which I'll say that I only had one child because I was not going through that again.
It's okay.
When it was over, totally I was like, okay, I'm not ever doing that again.
Yeah.
But so whenever you're leading up to the actual birth time, you're getting the exercises to open everything up to allow for delivery. That's what it sounds like.
Yeah. And there's another piece to it. Yes. So you are like, and you're really stacking. My mentor says this of like stacking the cards in your favor. So yeah, so you are aligning your body in like the chiropractic way, I guess you could say, your spine and everything. But there's a certain posture and observing a posture in pregnancy that puts women at a better, risk or in alignment better for a baby to kind of just like easily navigate that. And even not just even like the bones, like the muscles too. We don't ever think about the muscles and ligaments that can actually alter the position of the uterus. So there's that level of it too, right? So it's more than just like setting that part up, but balancing everything out to where we're getting all of it really supple and easy for baby to just kind of like settle on down.
I feel like this should just be a requirement.
Thank you. Literally. I don't understand. I mean, I'm trying to make the midwives and OB's job so much more easier, right? Let's just think of like no, I mean, it's like how much easier is it going to make your job if we can just help them learn how to push, get them in a better position? This is really where I get fired up, because it's like, okay, how many times can we prevent mom from getting interventions done or labor to take forever and stalling, or a baby having, and a doctor doing an opinion
wants to do the interventions. They just are so quick
some of them
to
are
do
like
it.
real cut happy, right? So it unfortunately is that way, but it's right. So it's like
we tried our best. So for me, I was like, I am going all natural.
Sure,
I'm doing the thing.
Mm-hmm.
Not realizing that my sway back, my pelvis, and the way it wasn't designed well for that.
Well, and so that is a thing, though. Most women, when that happens to them, they're like, I guess I'm just not built for this.
Right. But there's
How
no conversation about that in the doctor's office because that's not their specialty.
Oh, your baby's too big.
Well, I had all of those things. I had every single thing, like 100th percentile head size, sway back. But I did the little Moz class. So I was mentally ready to go. But had I been through chiropractic care,
right,
my body would have been better prepared.
Yeah. Yeah. There's so much to it. And that's a lot of the stigmas that I even try to talk about with other moms about it. Because, there's so many moms I hear all the time who have 10, 11-pound baby. That's wild, right? That's some big babies.
Huge.
Do so well, no tears.
Okay. That's amazing.
I've seen a mom. There was actually, when I was in chiropractic school, there was a woman, we crossed paths for some reason. She was 4'11", had her baby normal size, like regular child, no dwarfism, nothing. Okay. On her hip. And I asked her, I said, how was your birth experience? She's like, oh, I pushed my baby out. Nothing. No tears, no problems. Wow. Okay. Then why are we telling these women who, we need to get you induced because when you have a big baby.
Right. For generations.
Oh my God.
Hundreds of years, women delivered babies without
a millennia. How did we get here? It's only, this world is only recent. We've only been doing this for the past 100 years. So it's like, and then what does that tell us about our bodies? We're broken. We can't do it. That makes me mad. That gets me passionate about that because I am petite, but that doesn't mean my body can't do it.
Right.
There's so much. I had a woman message me the other day and saying hey, I'd really love for you to look at my x-rays. And I'm like, girl, I'm in no position and you don't even live here, to do that because my doctor told me that I can't do this said thing. And I'm like, your body is dynamic, right? Your pelvis isn't a solid structure. You have SI joints, you have a pubic bone, you have, your hormones that work for you. You and your baby are working at this. You need to stand up. You need to take a class, birth education class. You need to move your body, get into your headspace, prepare your brain and the endurance and the physical. There's so many aspects to it. Let's do that before we tell women they can't do it.
And we've talked about this before, the power of the word, especially coming from a physician or someone in authority.
And
if you tell someone you're not going to be able to do this,
that's
it's done.
Yeah, the seed's already planted.
Yeah.
The seed is already planted early on. And it is so unfortunate. And I try to really explain that to my moms when they, especially if they are trying for a VBAC. I'm like, hey, what happened? Let's talk it out. What really happened in that moment? Was it medically necessary? I can't tell you if it was medically necessary or not, but let's walk through it and unpack it and see if there was something that, we could maybe work on preventatively to help give you the best outcome for that.
Yeah.
So
after someone delivers their baby, I'm not going to go into my whole birth story, but
girl, if you would, I wouldn't mind.
It was enough for me to say that I wasn't going to do it again ever. And everybody's like, oh, you'll forget about that. No, I actually did not. So
never forget their birth stories. Yeah.
But so after someone delivers, there's a lot that has happened. Your body has been, my body was traumatized.
Of course.
And so what would chiropractic care do at that point to be able to get you into a space where you can move on without a lot of discomfort?
Mm-hmm. So the physical discomfort, right? Because usually sometimes women are, adjusting.
Of it. There's clearly physical discomfort, but so let's talk about that first.
Sure. Yeah. So, I think it's important to have somebody who isn't just going to address the physical pain, right? Because any chiropractor can do that. But it's looking at the whole person and saying hey, look, you experienced something really traumatic. I would highly encourage you, go see a maternal mental health counselor. I did that the other day. One of my moms, she had a really rough experience. And so go down that rabbit hole because it's necessary. And I mean, I'm just say right now, like I was planning an unassisted home birth, preeclampsia C-section, like complete 180, And so it's so important to, one, have somebody who can look at you holistically and say, hey, look, where's the root cause? Like, how are we going to, one, show up as your village and say, okay, where do you need the priority support most right now? Mm-hmm. Like, what is going to help you get through like the immediate care postpartum? So of course, I think of like, if someone was to go through that super traumatic event, okay, who's your support system? Who's your family that can help you navigate all of, did you have breastfeeding issues? Are y'all having issues with like a really fussy baby? I didn't touch on this, but like your baby, I hate to say it because I'm not placing blame, but it just shows the gravity of like the physical preparedness and how it impacts our children. Because I see it all the time when I have my little ones come in, especially if they're using more interventions. Those doctors are pulling on those children, and sometimes that can cause injury, right? Not the injury that we think of where it's like life or death situation, right, but it can really cause torticollis and all these other issues. So anyways, addressing the immediate issues postpartum. Is mom being supported? Is the family being supported? Is she getting the necessary resources? Does she want to breastfeed? Okay, is her baby comfortable? Are they okay? Is she getting fed? Is she resting? Not a lot of women are resting. Let's start there. Okay. I have moms coming in a week or two postpartum by themselves. I'm like, what are you doing? I don't work 2 days out of the week. I will come see you at your house. There's a reason I don't do that. So, or don't work those days. Like, it's for you guys so I can go see you. Take advantage of it. It's not like that much of a difference in charge, or we can work out a payment plan or something. Anyways, I think it's like immediately addressing those situations. And then if you have a fussy baby, you're already going through immediate postpartum of not sleeping. But then add a baby.
All the hormone changes.
Right. Jeez. Oh gosh. Yeah. You're sweating. You're like, I stink. Milk's coming out of me. I don't know what's happening. I have mastitis. I need to get in with somebody.
You feel like a crazy person.
Straight psycho. Yeah. Like, there's no cute way to say it, but it's also necessary. And I think it's just a matter of how we all set ourselves, like, because everybody is trending right now where, like, oh, the postpartum cart. Okay. We got to set it up. We put our pump. We put all our stuff. Okay. Did you save up for a lactation consultant? Or how are you getting fed? Like, who's going to tend to you? Who's going to help you walk to the bathroom? And, just like, I'm thinking all the things. And so,
we worry so much about the baby and taking care of the baby after, but there isn't much thought about, okay, what about
both?
Me
well, right. Yeah, exactly. I mean, I see it all the time where it goes from mom, and they go, whoop, and it switches right to baby. And we're like, hold on, wait, mother baby dyad. Yeah. And I think that's what I've always focused on. Something I've always really appreciated and really honored was that mother baby dyad, because it's so vulnerable, right? So early on. And you cannot wait to we can't just oh, we'll just wait it out and see how. No. The longer you wait, the harder this is to unravel. Right? So helping them process that trauma is as honest, as early as you can. Because usually sometimes moms are getting in 2 or 3 months down the road, maybe 5 or 6. And by then it's whew, this is hard. Yeah. They've lost their supply. They're having pain in their body, their back aches. I thought I needed chiropractic care during pregnancy. Try co-sleeping with a baby who doesn't want to sleep. Is rough, with a posterior tongue tie, it's all the things, and you latched on 24/7. That's a lot. Yeah. And so that can be hard on your body. And so I just made sure for myself, I encourage moms for both of them to get worked on. And we go through breathing and movement and things that are safe. Usually with the postpartum workout, doctors are like, hey, you have to get cleared for, which you do, right? There's, the magical 6 to 8 weeks for some reason that involves nothing happening until then. And then all of a sudden you can have sex. That's supposed to be fine. But no one's actually evaluating these moms or doing anything with them even right after. There's so many things you can do that is gentle and proactive and preventative to support your body in healing. There's so many really traditional things and non-traditional things that you can do, but yeah. Sorry. Yeah.
So what would you do with a newborn? Like, how does chiropractic care help with a newborn? Because quite honestly, as a mother, so my son turned 17 last week. And so it's been a minute since I went through all of this. But also, at that time every year, I kind of go through the whole experience of, I pushed for literally 3 hours and you were such a pain. It was so hard. So it kind of, I relive all of that stuff. Yeah. But whenever he was born, when my son was born, he was taken straight to the ICU because he wasn't breathing correctly. Yeah. He had been in my birth canal for so long that he literally looked like an alien. I told my husband, I was like, that is not my son. That is an alien. He does not look like that's not a human child there. So there were a lot of things. Like, they thought he had brain damage. They thought he had kidney dysfunction because he had a skin tag near his ear. And so apparently the ears and the kidneys develop at the same time. So, I mean, there were all of these things that they were telling me immediately after having given birth. And so he stayed in ICU for a week. And after that, he was fine. I mean, he had no damage. He had no kidney dysfunction. His brain was not damaged. He was a perfectly healthy
It's still a lot
infant.
To process.
My cousin is a neonatal ICU nurse, and she was like, you should take him to a chiropractor. And I was like, wow. No, we just got him cleared. We're not going anywhere. Like, he's going to stay in my arms. There's no way I'd let someone else touch him. Yeah. So that was my perspective then. Obviously now I would see things a little bit differently. But so for a mother who has carried this baby for 9-10 months, what would be the reason that they would hand them over to someone else to support them? Like, what kind of support could you give to a newborn?
Sure. And that, and that's totally valid for you to feel that way. One, because of your experience of like everything you went through, and NICU is so hard. I don't have any NICU experience, but watching other women and some of my best friends go through that and being separated from your baby, I can't like, I want to throw up thinking about it. So I'm so sorry that happened to you. It's the only
experience I ever had, so I don't know any different.
No, for sure. And I mean, like, I get it, because thinking that for myself, like vaginally, like thinking I'll have that experience and that closeness and honor all of the domino and physiology that goes into everything. And then I'm going to share something really vulnerable for a second, if you're okay with it. I felt like somebody just gave me a baby. Mm-hmm. And I don't think a lot of women talk about that.
Yeah. Like,
think of whenever animals give birth. Don't touch them. Keep them close together.
Right.
She needs to, like, think of like a bird, right? You wouldn't touch a bird, like a baby bird. That mom will literally disown that baby.
Right.
They'll die. I mean, I hate to say it, like, that's so gruesome, but it's true.
Yeah.
And I don't think a lot of people talk about how hard that is when those hormones and everything is disrupted.
Yeah.
For you to be like, wait, that's mine. I've heard stories of women having experiences like that and then having another kid and then being like, I hate that. I don't feel the same way about that with my children.
I had a very similar birth story to Daphne, actually, and we've never talked about this, but I also pushed for 3 hours. Mm-hmm. She came out like a pineapple. But ultimately had to have an emergency C-section because she was sunny side up, and
that's hard. Yeah, that's usually a harder. Yeah,
and her head size was also enormous. And she was whisked away immediately. Mm-hmm. And I don't think I saw her for 2 hours after. Not to mention, every relative was in the hospital because we've talked about this before. My partner had died when I was pregnant, so everyone was there, and so it was like,
oh my gosh,
it was very weird. And I was so high on drugs. Yeah. I was all natural pushing her, but after I had to do the C-section, I had the spinal and all that, and I was just like, did I just have a baby? Like, I almost didn't believe that I had just had a baby. It was so bizarre.
Yeah.
The hardest thing for me to deal with in that moment was when I got her back, it took like a week for me to even feel anything.
Mm-hmm. Yeah.
That was such a
hard. It's a mind game.
Yes.
It's so hard.
I was about to say a mind bad word.
It's your podcast, girl. If you want to say it, I don't.
What is happening? Because I was so excited for 9 months, and then I was just like, what is this?
Yeah.
And finally, I love her. Like, we're
it doesn't change anything, right?
Yeah.
About your dog, about your kids.
It was like we were not bonding.
It's hard
emotionally. It was very strange.
It's really, and I will say this though, I have heard, I guess on the other side of things too, I still have heard women still go through like a regular vaginal delivery, no issues, and still have that experience. But I find it to be way more common with women who have all gone through the same experience as us in some capacity, because our baby was, we didn't like see our baby come out, or they were taken from us. Yeah. I was really grateful that my sister was actually, fortunately, working at the hospital that I went to. She was actually was part of the OR team.
Oh, wow.
Yeah. So they have a very unique bond too. But as soon as they could, I was like, put her on me.
Yeah.
Like in the recovery room, all the things, I was like, keep her by me. I don't want her out of my sight. I want her as close to me as possible. And I just kind of dealt with it. Yeah. And that was just kind of how it was. And I was like, here we go, healing together. So, oh man, I'm gonna start crying. It's like you just kind of do the things that you need to do to protect yourself and your baby, and like protect that bond of y'all together.
But even people that don't have traumatic birth situations still need to go see you.
Oh yeah, sorry. I totally ran around your question. So, so birth can be a big experience for not just mom, but baby, right? So we covered all of the imbalances and how that affects mom and labor, but that makes sense, right? Too, with like, okay, taking a long time to push, all this other stuff. And we talked about interventions that doctors unfortunately have to sometimes just, I will say this, I'll give credit where credit is due, because most of these OBs are like, hey, look, you can try, go for it. Like whatever you got to do at some point, if baby's decelling too much, we've got to do something.
Right.
And like, that's just them doing their jobs. Right. So I would even just say, without knowing anything about the baby, like if that is not enough of an excuse to just bring your kid to a chiropractor or a pediatric chiropractor, then like, let's start there. I can see why moms are so worried about bringing their baby to a chiropractor, because it's so popular on social media that you see these like popping and like the sounds are fun, right? Like they're cool for adults, or some people don't love it. I mean, it's hit or miss, right? Like some people are like, oh, I love the sounds, and like, oh, can you do, what? And then other people come and they're like, I don't want anything. I don't want any part of that.
Yeah.
Right. And so you're like, how are you going to do that to my baby? I don't want to do that.
Right.
If I can give you any, I'm a very light-handed kind of person. I think because I was one of the smaller ones in my class. We didn't have a big class, but I was definitely one of the smaller ones. And I had a lot of like really big men in my class, and they would just like power through it. And I mean, we were adults, so like, it's a little bit different, but sometimes it's like you're powering through those muscles that are tight. There's no respect for that person, their nervous system, and how safe their body thinks that they are.
Right.
So I kind of, less is more in that sense. And we kind of like build up trust. I have to build up trust with your body. It's the same thing with your baby. Nothing different there. When it comes to their little ones, I mean, I'm looking at them from a full, again, another holistic perspective. And so I'm only really using like, if I could, if you touch your eye, if you close it and touch your eye, like that's how much pressure I'm using with a baby.
It's not like cracking bones and moving stuff
I would
around.
never. No. If you see a chiropractor doing a rotary on a baby, get out of there. Run. Like whenever you see an adjustment done. Yeah, it's like, and then they turn their head. So rotary, rotation.
So with an infant, it sounds like you're kind of just making sure that everything's in alignment. I mean, gently in alignment, because I'm assuming, this is not my space, but
ask the questions.
Bones, everything's very pliable.
Everything is so pliable, and and their bones are growing. It's a lot of cartilage. I mean, really, but it's not just. I can't speak to, because there's so many specialties and different techniques, right? Like you go into the chiropractic, there's multiple practitioners who are maybe working in the perinatal pediatric space, but they're doing it a whole different way as far as like technique goes. I can only vouch for the things that I do. But again, in the pediatric space, you're at least gonna know that if you go to somebody like that, they're going to be very gentle with that, so you can trust that, knowing it. I also like looking at the whole picture of the baby. So yes, I am looking at their spine, I'm looking at their pelvis, I'm also looking at their head. Okay, how is that affecting, maybe they did have some, some coning and stuff. And that is a wonderful a way to adapt to birth. Like their heads are supposed to do that. And you're like, oh yeah, like how hard they had to work to get around that funky door, you know? Yeah. And it's like, okay, how can we help them get into a really nice, and if you've ever researched, it's called craniosacral therapy, but we just like how we have blood flow, we have nerve flow, we have lymphatic, we have oxygen, all these things, right? And then there's craniosacral rhythm, right? So this is the fluid that travels around our brain and our spinal cord, and it just, it protects our nervous system in that way, and it flushes out toxins around the bigger, those parts. But it's really cool because there's this like beautiful synchronicity that happens, and sometimes you can have tension in that fascia within the spine. And so from there, in the chiropractic world, we'll sometimes use like the word subluxation, right? But it's just a fancy word for like there's a tension that first started, and your body, when you don't address it right out the gate, your body is constantly adapting to that stress, right? Like you hurt yourself. Okay. You are in a boot, your pelvic, you hurt yourself at some point, your body is going to adapt to that. It's the same. Like we're not, you're not exempt from that.
I'm sorry. Through infancy and like toddlerhood and childhood, the role of the chiropractor at that point would be to make sure that everything is loose enough so that their body can adapt in a way that their muscles and ligaments can perform the way that they're supposed to.
Yeah.
Is that right?
And you have less stress on your nervous system. It's so fun that this nervous system talk is starting to become so popular nowadays. And us chiropractors are like, finally.
Yeah.
We've been working with the nervous system for a long time. It's what our profession is found on.
Before we get too far away from it, craniosacral therapy.
Yes.
I know there's a difference, but what would be the difference between that and just getting a massage?
Oh.
Is it just more specifically? So
you're working. Okay. Sorry. Thank you. Yes. So with cranial work, with the baby, so you have all of these bones in your skull, right? That make up and kind of do that pumping mechanism that helps keep flushing, that CSF back and around. And so what can happen is one of them might get locked in, right? And so if it's really subtle, it's so subtle. And so it just kind of whoop, and then it comes here, and then the back, it opens up, and then it comes here. And that's that pumping motion. And so when I'm evaluating little ones, again, I'm not just working on their spine. I'm working on this as well, because I don't know if we were talking about tongue or lip, but like we were talking about tongue and lip ties before we recorded. And that goes so much into a high palate, the jaw being crooked, misaligned, exactly, deviated. And that all has to do with how all of these bones are restricted.
So you work with kids with the tongue tie issues too?
Yeah, half the time I'm the one that catches it. I'm like,
so what would you do with that?
Let's see. So technically I can't really like diagnose it, but I'm checking them functionally, right? To say, hey, look, I think this may be a little bit more tension related or based off of all of the things that they're having experiences with, like if they are breastfeeding or not. I'll say, hey, look, I think you need to go see a lactation consultant, a feeding therapist, an pediatric OT. Like there's some great people in our community. And so what usually happens is moms will come in because their baby is colicky and reflux and they're uncomfortable or not pooping and all these other kind of things. And I'm like, hold on, wait. Like, let's look at this. Are they even eating well? Are they gassy? Okay, why are they gassy? They can't get a good seal.
Swallowing
they're popping.
All the air.
Yeah, they're swallowing all that air. They can't get a good seal. Okay, can they get a good seal, but they don't keep it? So I'm looking at it in all these ways, and it all has to do with, okay, is the jaw lining up? Here's another thing. Like, is there tension fascia? I mean, if y'all have ever looked at fascia, it's why I don't just focus on like one area. There's actually, I think a post, I reshared this actually yesterday. It was the attachment points and how interconnected our fascia is from our tongue all the way down to our toes.
Wow.
That's some cool stuff, right? Right. Yeah. So like that's how much that is affected. And that's why I can't just work on one area of your baby. We have to look at everything. Yeah. We have to bring in a whole team. Are they strong enough to, okay, we got them to turn their head. Maybe they're favoring one breast or looking a certain way, but now they can do both ways. Okay, maybe they're not strong enough now. Maybe we need to bring in a PT or an OT to help build up those muscles, or give mom some exercises. Try this out. If not, we need some other help.
Yeah.
So
my best friend is a massage therapist. My best friend Jackie, but not this Jackie. I bring her up all the time. She talks about fascia, and she always relates it to saran wrap.
Yes.
That if you have saran wrap that's laid out and you pinch this part, it affects how everything else.
Oh yeah.
Like everything else is laid out. So that was my best visual to understand like what fascia is and how it.
You ever seen those like tensegrity models? You ever seen those before? Wish I would have brought it. I have. Yeah. So it's really cool because it shows, there's one when I did one of my trainings that I've done for pregnancy, and she was showing how like when you move one section, like the whole section will move. Yeah. And it's so great. Like, it's just so interesting how like I'll have patients adult patients who come in and they're like, oh, I think it's this. And I'm like, actually, it's this thing is the root cause of this, but it's interfering with like your gait or something. Basically, you're like, everything's connected. So that way, when you move one thing, it just shows you globally like a really good visual of how everything shifts because of that. And that is such a good representation of like your body quite literally adapting to the stress you put it under, whether that be physically, emotionally, or chemically. Period.
Let's get back to the nervous system, because
Okay.
we were starting to talk about that a little bit. I want to talk about how our nervous system affects our overall health.
I think chiropractors, we have this really cool way of having this, and not all chiropractors, I'll say this, because if you're in the like PT world, and I say PT, let me back up because not all PTs are like that either. Very musculoskeletal, pain-based model. When you're in that model, it can become very, hey, do this. This is the diagnosis. Let's do this stretch and exercise and all this other kind of stuff. Unless you have a practitioner who keeps the nervous system in mind. And so when I'm working with people, while I still do that, because a lot of times they're not moving their bodies like they should, because that is a physical stress that they put themselves, unfortunately, under, or they don't know, right? We don't ever notice the patterns that we have adapted to, right? When I'm, evaluating somebody, I can very easily talk to your nervous system. It sounds very woo-woo. very, very woo-woo.
I think most of our listeners are probably a little woo-woo. So
yeah, okay, cool.
Safe space.
We're good here? Okay. Yeah, so it's really interesting that I've learned different ways and techniques, and I've definitely meshed a lot of them. Like I do my very structural analysis, but I always end up going back and like checking in and saying, okay, maybe there's a little bit of hypertonicity in this area and lower in this area. Okay, breathe for me, do this. Okay, let me see if this changes. And I'm constantly checking in and doing different, hey, move your head this way. Okay, maybe that wasn't it. Okay, let's try something else. Let me adjust this area and come back and see if this loosens up. It's really fun. It's just like you're helping someone unravel. I had one time, there was a woman, I'll never forget this. She was like a regular patient of mine a long time ago, fertility patient. She always had like one spot. And sometimes everyone is different, right? Sometimes I give them all the things, and sometimes less is more. And I've understood over the years which people to do that with. So anyways, this particular patient, she had just this one little specific area that, I would always go to. And at some point, it just was not clearing. Like it would not hold. I was like, what is going on? And I was like, okay, let me check in with her body. Is this physical? Is it an emotional thing? And it was like her body let it go after it was emotional. And so I asked her, I said, what's going on in your life that's like really stressing you out emotionally? And she lost it. She was like, something happened with my best friend's daughter, and I'm helping her go through that right now. And so I was like, okay, that's what's going on. And you're holding it in your body. And so when you have someone who doesn't address those things, or at least doesn't take it into consideration. I mean, I've had women before where I'm like, hey, look, that's why I tell women whenever they're postpartum or something, you really need to go look at this, go see a mental health counselor, go look at all of these things, because if you don't, your body is just going to adapt to it. you're going to hold your breath. You're going to have your shoulders are going to be tight. Like it's so classic for women to be like, my shoulders are so tight all the time. I just always hold my stress here. And it's like, okay, why are you doing that? You know,
that reminds me of that book. I have not read it.
The Body Keeps. Yeah. Body Keeps Score.
It's one of the.
It's a heady book,
on my
but
list.
yeah, it makes sense.
That was a heavy one.
That is
a heavy book.
I feel like that's also why it's probably beneficial for you to move slow with a lot of people, because just earning their trust helps them loosen up probably a little bit too. Because you walk into an office, someone you don't know, you're not just going to be like all loosey-goosey on the table.
I guess that's why I also try to do as much as I can on social media for people to know who I am and build that rapport with them. One of the other things I learned really early on in chiropractic school not in school, but when I shadowed a lot of offices that were perinatal pediatric, was because there were so many parents who were used to the medical model and being in doctors' offices, we were like, how do we make it feel like they're not? Like they're at home, like their body can feel safe here.
Yeah.
And that's kind of what I've always tried to do. I have many offices, but like what I've always tried to keep that at the center was like, I want you to feel safe here. I want your kid to come with you and, you know, not think mommy's going to get hurt or, you know, all these things and be scared, or like, especially if mom's coming in and eventually she wants her kid to come in. I want them to feel safe that like, I'm taking care of mommy. They can help me. Things are good. This is just another place we're playing and we're going to feel really good here. Cool. You know, that way, by the time they are actually getting treated, they're like jumping on the table. They're excited. Yeah.
I like that. Yeah. There are not very many safe spaces.
Well, yeah, because it's so like sterilized and it's just fluorescent lights and minimal, like all these exam tables, and which, I mean, look, you have to have the, you know, whatever. But if we can make it just as homey as we can, then that helps a lot.
I like how you focus on educating people too. You're not just dictating information and telling someone how it is. I like you empower people to understand their bodies themselves, especially women, obviously. That's your main target. But I think that's so important for us, especially taking control of your own health, to understand why certain things are happening and why we're doing certain things.
Yeah. I think it goes back to what I shared a little bit earlier about my own story, where it's like, okay, these things are happening to us. This is what we have access to in the medical model. What do I do with that? You know, like if you really are trying to heal from something, you almost have to literally take control of it yourself and be so involved in it. You know, I try to help women in that capacity, because a lot of times in birth, they're like, I'm gonna just wing it. And you're like, oh, shoot.
Yeah.
You know, that sometimes that is, you know, that can work.
Yeah.
Not always, but it's like, you know, you're just throwing darts in the dark or whatever. So I think also too, it should be said that, you know, as women, we've always been like, hey, this thing's going to happen to you. You know, we're going to do this and all of your, everything that will make you feel empowered will be outside of you. Right? Like we weren't taught as young girls to like have a relationship with our body or our cycles or anything like that. So let's start a little bit younger, right?
Right.
And then what does that translate to? Women who have no relationship with their body whatsoever. Okay.
That's when they come see me. Right. Because that relationship, they've kind of gotten so
disassociated
exactly with who they actually are, their physical body, their emotional self, and then they're just eating their way through everything. So
right. Yeah, exactly. Yeah. One thing I do with them during pregnancy is while I give them plenty of so many exercises and things to do based off of their goals that they want and like the pain that they're in, I don't always necessarily give them like a rep or how many that I need them to do, unless it's like, hey, look, I need you, unless I'm stressing the importance of like how often you need to do it, or like the frequency or that kind of thing. What I really get them to do is I'll give them a variety of exercises or movements and how that looks in different positions or different things. And then I tell them, I said, okay, I want you to go home, put some music on, get your husband or your partner or whoever, if you have other kids, like you need to do this by yourself in a safe room that you're in, put headphones, close, you know, put the lights off or whatever. It doesn't matter. So, but you need to get in your body, because birth is not a logical thing. Mm-hmm. You have to be in your primal brain. And how beautiful of a gift. That is only building your intuition within your body, right? So like if you're practicing these movements before you're even, like we're unraveling a lot of tension and you're constantly being able to show up for yourself when things arise. Mm-hmm. But then how cool that you get to do that when you're in labor, to access these motions. That way, whenever you're in labor and you're like, okay, this doesn't make sense, but I'm going to like put my leg up right here, you know, and do this motion. And all of a sudden baby drops and you're like, I don't know what just happened, but like that made sense to me. Yeah. Intuitively, you knew what to do. And so that's just so cool. And like how awesome for you to get and build your intuition within yourself. That's motherhood in a nutshell. Like how many moms you're like, I don't know, I just had like a weird feeling in my gut, you know, like we all have kids. So it's like, I don't know how I feel about that, you know, just that kind of thing. So you're building that intuition muscle again within yourself. We're trying to do it then. So
yeah, I feel like we're really kind of severed from our intuition.
Oh yeah.
In this modern time that we live in. Because
absolutely.
Like that's a whole spiritual conversation.
Yeah. I mean, yeah, that is a whole separate conversation, but we're definitely not encouraged. I think most people don't even consider it to be an option.
No,
They don't even recognize it. Mm-hmm. And so it's certainly not something that's encouraged or pushed to really listen to your intuition.
Mm-hmm. Well, and then it's hard too, because if you're having your baby in the hospital, let's say, there's nothing wrong with that. But if you're getting like induced or anything like that, and you don't know how to navigate an induction and have a little bit of freedom, you may find yourself just sitting there. And that is not great for birth.
Yeah.
Like to just lay there, right? And then get an epidural and then just lay there. Like birth loves movement. That's why whenever you see animals or like home birth video, women are like,
walking around, moving and grooving.
Yeah, exactly. They're pacing. And they are getting movement so they can help work together with their baby to get down. Yeah. So it's really interesting whenever I see that, like on videos where moms are like, okay, I guess I'm here. And I'm like, oh my God.
That was me.
Get up and roll around. Like, let's do so. Get up and move, you know, and that's going to help with pain management because everyone's scared of in birth and pain, like with pain, which is rightfully so. I mean, it's intense.
Yeah.
So.
But if you know what to ask for.
Right. Well, that's where the empowerment comes from. Yeah. And I always tell moms, I'm like, we got a podcast. Like, go listen to them. We got a whole dang thing. Like, go listen to the podcast. A lot of times they're OBs. Most of the women that I see work with OBs, right? And so I know they're limited on the time that they have with them. They're seeing me a lot more frequently than they are their OBs.
Right.
So, and then I have a childbirth education certification. So like, you know what? Go ahead, go home, research some stuff. If you have a question, let's talk out some options. That way, maybe we can help a little bit. That way, by the time you go to your provider, you know, like the exact question to ask or,
that's
you know.
What I think, like for me, what's the book? What to Expect When You're Expecting.
Oh God, I don't love that book.
That was, I think, the only book that I read. Yeah, and then I went to birthing class. I don't want to make this all about me, but my husband was not able to attend because he had to work. So I was the only single person. Mm-hmm. I wasn't single, but like the only solo person in the birthing class. And I went home and he's like, well, how did it go? I'm like, how do you think it went? I either have to push this baby out of my vagina or I have to get cut. And I don't want to do either one of those. Right. So we have to come up with another option. Like you have to come up with another option for me.
There has to be a third thing.
Like, there's got to be another way to do this. Mm-hmm. And he's like, oh,
I don't know about all that. Yeah.
But I don't think that we are given... I mean, I know that there's not a third option. Those are your only two options.
Pretty much the only ones, yeah.
And all of the other decisions that you have to make, you're not really given a good, like, okay, this is the direction you could go. This is the direction you could go. And these are the pros and cons of each one of those. Mm-hmm. So that's what I would have hoped birthing class would have been, but that's not at all what it was. Yeah. And so I think there are so many options. We don't know what to do. We don't know what the options are. And so when we're presented with, like, do you want A or B? Like, you just choose probably the one that you've heard the most about. Like, because you just don't know what to do.
Protocol in like the obstetrical world and in birth where it's like, okay, at this week we're doing this. There's not like a whole lot of
There's no conversation.
It's like, hey, you're gonna do this. And like, what I think that's one of the things I love about midwifery is that while it is part of their protocol and policy, like they at least give you the option, say, hey, look, okay, if you don't want to do this, here's the other option. If you don't, this is what may happen if you don't. these are your options. At least you know ahead of time.
I think taking the birthing class at the hospital, when I went in, I was thinking it was going to be like a Lamaze. And I was so disappointed when I walked out. I was like, this is not information. Like, I already knew all this stuff. Yeah. And I'm so glad that I took Lamaze. It was, I don't know, 6 weeks or however many weeks I took it. Yeah. But it really prepared me mentally to go through it. And I think that's the main thing that got me through giving birth too. Even though I ultimately had a C-section, I was like riding the waves and I was having like an out of body experience. It was really crazy, but that was the best thing that I did. Should have also done chiropractic.
No, it's okay. I mean, that was
8 years ago. I didn't even know.
For sure. You know what? I hate that because with women who they're like, oh, I'm gonna just go to the hospital birth class. I'm like, please take an out of hospital, like an independent class, and you will notice the difference. It's so different. A lot of these are taught by doulas, and they have their own perspective of the hospital system.
Yeah. Oh, I had a crazy doula. She was awesome. She was fussing at everybody.
That's my favorite. Yeah.
They're like, don't you want an epidural? She was like, no. She will ask for medication when she wants medication.
That's right. Literally.
She was intense.
Yeah.
And just the sisterhood, because the class that I took was with a bunch of other moms.
Oh yeah, they're all in the same
and I
season.
Still am on Instagram following each other, and we don't really see each other ever anymore. But
it's still nice to be like, oh my gosh,
our babies were born like days apart, and
it's
so really
fun.
cool. It's just like a sisterhood thing.
Yeah, I do stress that a lot with my moms. I'm like, right in the beginning, before we even get into why they're there, I'm like asking who's already part of their birth team, where they're having their baby, who's their OB, who, midwife, that kind of thing. Are they taking any classes? Are they planning on breastfeeding, that kind of thing? So that way, even while we're going through all the stuff that they're here for, okay, I need to make sure you have this person on your team, or at least you have the resources to go reach out to them for that, so we can prevent a lot of the trauma that, could potentially happen.
Yeah. Prepare yourself for the things, because your plan is not going to go according to plan all the time. 99% of the time.
Majority of the time it doesn't. And I'm glad you brought that up, because a lot of times people will either have a birth plan to the T, or they're like, I have seen friends of mine who have had birth plans and it just go to crap. And so I don't want to let myself down. And you know what? I completely understand that is a stress response and a protective response for them. And I get it because of the experience like I said, I planned a home birth. Didn't happen that way. But I would say have a plan A, B, and C. And I think what's even more important is understanding your values and what you value in each step, regardless of what happens. So that way you don't get to a point where you're like, okay, we've kind of got some hiccups going, a little stall here and there. How do you feel about it? Okay, I don't feel like that. I'm not doing that. Here's my boundary.
Right.
Okay, we at least know where you're at. Not, I didn't think I would get here, so I'm just gonna and then you're like
making a decision and a stress response.
Yeah, it's so much. It's a lot, which unfortunately happened to me. But so I understand, but it's so pertinent to kind of be in the in-between where you're still coming up with something, or at least getting dream up your dreamiest birth experience, right? Because it is important to set the intention of how you want things to be, the people you want there, you don't want to be there, your support system, right? All of those things are important. And then your values within that. Okay, cool, we have that. And then from there, okay, what do we do if something like this arises? Okay, perfect. How do you feel about an epidural? The epidural is not the devil. Sometimes you do have little hiccups that happens with them. Sometimes they don't always work, unfortunately, or have little hot spots here and there. And okay, perfect. How are you going to navigate if those little things come up?
Yeah.
It's also, just little things like that.
Communicating with the person that comes with you, whether it's your spouse or your birthing partner, so that they are aware of what you want too. Because when you're in the moment and you're in pain, you're not thinking straight. I was on another planet.
Oh, I couldn't have
answered a question.
Words to my mouth.
Yeah. Yeah.
I'm glad you said that, because most women, especially first-time moms, I would say first-time moms and VBACs 100% need to hire a doula. Unless you're one of those women who just walk in and have your baby, you probably don't need one.
Yeah.
But majority of the time they need them, because they can help navigate so many things. Doesn't mean you're going to avoid, like, it doesn't guarantee like, hey, this isn't going to happen because you have your, it's like, I'm thinking of somebody in particular who she didn't have this was her first, had her baby, and then, let's see, how did it happen? She did end up in a C-section, and the doctor was like, we can still try for a few more hours, but it's going to be a few more hours. And she was like, oh my God, no way. And then her husband is on the other side being like, get my wife out of pain. Yeah. And it's like, that's not what she wanted. You know what I mean? Like how would it have, I mean, I don't know in her situation, but like, how would it have been if she would have had somebody to be like, you're doing great.
Yeah.
Just a little bit more. Like,
you made for this.
Let's put you in another position. Let's switch it up. Mm-hmm. You know, sometimes partners, they can go to the classes with you guys and be fantastic at it. That does not mean they are professionals in that space and know how to handle things when. And a lot of dads don't want to see their wife in distress or their partner in distress, and like, just make it end or they get sick. Exactly.
Feeling.
There could be a woman. That's why I tell dads to go look at beautiful, birth experiences where they're like calm and everything's wonderful and very boring, more or less. And then I said, then I want you to go look at videos where they're like very vocal.
Yeah.
Because if you're not used to that, you're going to think she's like burning alive inside and inside she's like killing it, you know?
Yeah.
And so it's nice to have somebody there too. I mean, there's a lot of times where doulas are hired just for the parent, just for the partner. Yeah. Because it's like, hey, look, we're going to help you out. We're going to keep him calm for literally that particular reason because he needs support, right? Mm-hmm. It's not always because of mom. And sometimes moms don't need a lot. It's like, okay, rub my back, put some pressure here, and sometimes they're really great for getting dad to be involved. Go tell her she's doing a great job. Oh my God, I love him. He just knew exactly what to say.
Yeah. Feeding him the script.
Right. Yeah. You're welcome. We're making you look good, So I would highly encourage that for first time moms, especially in VBACs.
Yeah.
I've seen sometimes if in the unfortunate transfer, okay, so they go to the hospital and sometimes the midwives can go and stay and check on them and all this kind of stuff. But sometimes they're maybe at another birth and they can't be there. And so they didn't plan a doula. And so, your midwife is not your doula, right? So like, they're going to help you, do all the physical stuff with that and mentally. And I will say this, there are some midwives who are really involved with their patients, but as far as like helping them navigate, sometimes I've seen that be really difficult for them with that. And so when they transfer, it's like a shock because like, oh my God, I thought I was going to have my person here with me and I was safe.
You're alone now.
Yeah.
Now I'm in an unknown territory that I didn't think I was going to be here. And now I'm like freaking the F out, Yeah. So I think regardless of if I had a doula with mine. I was planning that. And then I had a C-section. I was so mad when they would let my doula in. They were like, oh, she can't. I was like, what do you mean she can't come in? Let her in. I need her.
Hold my hand.
Help me breathe.
Yeah.
Because I was having a straight panic attack on that table, y'all, for real. And I thank God I knew some like very basic breathing techniques because that's what got me through it. Like as soon as my husband was able to come in the room, I looked at him and I was like, your only job in here is to help me breathe. Remind me to breathe and just kind of, keep it at that. So anyways, and so that's nice to have people who, again, are your support systems or even just to be like, hey, look, things are going to get kind of crazy. Your baby might have to be transferred or NICU and all this stuff. Everything's okay. Do you want me to, I'll stay with you. Dad can go with baby. I'm going to walk you through what's going on.
Right.
Because they stay with you for until everything's calmed down.
Right.
Right. So in the event that something happens, right, they're there to walk with you through that. And not a lot of times moms have the people to sit with them and process their birth. And that's one of the really cool things about having them on your birth team is they will do postpartum visits with you. Mm-hmm. And hey, let's talk out your birth experience. What happened? How are you feeling? Let's, what's maybe not sitting quite right. Let's walk through maybe what happened. Let me give you some time slots and what's going on with that. So anyways, I know this was a chiropractic episode, but it's birth.
Yeah. Moms and babies.
That's
always
right.
an adventure.
Yeah.
Well, before we wrap up, we have to ask you one question that we ask all of our guests. What does living vividly mean to you?
for me, that's just like being able to be healthy within my own body and having that be the same for women. And being able to, I don't know, just honor all the phases of life and adapt to it and be able to just support all the big transitions that happen within life, good or bad, and just be the village for people with that. So I don't know if that was a great answer.
Yeah, beautiful answer.
So yeah.
Well, thank you so much for coming on.
Thank you so much.
Fun. We could have talked for 3 more hours.
Oh yeah, easily, for sure.
We'll have to have you back on.
Yes. Thanks for that. Yeah.
Thank you.
That'd be great.